I'm going to go through what you should do if you've been exposed to a patient's blood. I'll explain the first aid measures you should take and then talk about how to report the injury.
Oh, yes. I'm really worried about getting a serious infection if I look after patients who are very ill.
I understand your concerns, but it's important to keep in mind the risk reduction measures I talked about earlier to avoid injuries.
You mean about using sharp spins properly?
Yes, and not resheathing needles after giving injections.
You mean not recapping needles?
That's right. After giving an injection, the syringe and needle should be disposed of in a sharp bin immediately.
Okay, but what if I accidentally have a sharps injury?
The first thing to remember is follow the same procedure for all sharps injuries. This is because you may not know whether the source of the injury carries a risk of infection or not. If the blood is infected, you may not know the type of infection.
Okay,
First, wash the site of exposure with lots of soap and water without scrubbing the area.
should I use antiseptic wash?
No, that's not recommended. Just liberal amounts of soap and water.
Should I try and squeeze out the blood?
No, don't squeeze out the blood or try to suck it out. Instead, allow some free bleeding of the wound. This means that you allow blood to flow out of the wound on its own.
Okay,
After you've cleaned the area, dry it and put on a waterproof dressing.
okay. Will I need any treatment after the injury?
It depends on the level of risk. That's why you must report any needlestick injuries so that you have access to medical advice. If the level of risk is assessed as low, you may not need any treatment. If there is a risk of exposure to hepatitis B or C or HIV, post-exposure treatment may be needed. This might include vaccination against hepatitis B, taking antiviral drugs in the case of exposure to hepatitis C, or PEP in the case of exposure to HIV.
Okay, so the first action is to clean the area with lots of soap and water. Encourage bleeding without squeezing the area. Dry it and cover it with a clean dressing. Then I report the injury so the level of risk for infections like hepatitis B or C or HIV can be assessed.
That's correct. Also remember that prevention of needle stick injuries is equally important as the management of the injuries.